The pharyngeal arch arteries, also called aortic arches, are critical, transient vascular structures that form the basis for the major arteries of the head, neck, and upper chest. Pharyngeal arch arteries. Definition: they are a series of 6 pairs of symmetrical arteries that form sequentially in the pharyngeal, branchial, arches of the developing human embryo, around the 4th-5th week, that connect the developing heart, via the aortic sac, to the 2 dorsal aortas. 6 pairs of arches, numbered 1, 2, 3, 4, and 6, are typically described, though the 5th arch is often rudimentary or regresses completely in humans. First arch mostly regresses. A small part remains as the maxillary artery. Second arch mostly regresses, contributes to the hyoid artery and stapedial artery, which later disappears in most humans. Third arch forms the common carotid arteries, CCA, and the proximal internal carotid arteries, ECA. Fourth arch left side, forms the arch of the aorta, the segment between the left common carotid and left subclavian arteries. Right side, forms the proximal right subclavian artery. Fifth arch regresses, disappears, rapidly and does not form any significant adult structure. Sixth arch left side, forms the proximal left pulmonary artery and the ductus arteriosus, which becomes the ligamentum arteriosum after birth. Right side, forms the right pulmonary artery, proximal part, and the distal part regresses. Significant congenital anomalies that result from errors in the regression and persistence of the arch arteries. Dysphagia lusoria, abnormal right subclavian artery. This anomaly occurs when the normal development of the right arch system fails. It includes obliteration of the right fourth arch artery, which normally forms the proximal right subclavian, and persistence of the caudal part of the right dorsal aorta, which should normally regress. Results: the right subclavian artery originates abnormally from the arch of aorta, instead of the brachiocephalic trunk. It must then cross behind the esophagus to reach the right arm. The artery compresses the esophagus, leading to difficulty swallowing, dysphagia, hence the name lusoria, meaning a freak of nature. Double aortic arch. This is a more serious anomaly where persistence of both fourth arch arteries and the dorsal aortae on both sides. Result: a vascular ring forms around the trachea and esophagus. Clinical effect: severe compression of both the trachea, causing respiratory distress, and the esophagus, causing dysphagia.
Thanks for watching. Subscribe for more updates.